Hello everyone, this is Dr. Inam Rahman, your consultant orthopedic physio at Orthoflex Physiotherapy, Mysore, and today we'll be discussing about low back pain because it accounts to at least 60% of the total cases I get to treat at my clinic, and and also because it's the second most common type of pain after headache. Today I'll try to share as much information as possible, give you as much insight as possible into low back pain by keeping my words simple and understandable. But some words and terminologies may pop up here and there, but I'm sure you guys can get a hold of it. Now, low back pain is actually a symptom rather than a disease in itself, which occurs to everyone, almost to everyone, at least once in a lifetime. But having said that, there are some risk groups, that is, people who are more susceptible, more prone to get low back pain in their lifetime. We have categorized, we have made some risk groups. For example, when I say lung cancer, the main risk group that pops up in your mind is smokers, but it's not necessary that all smokers get lung cancer, and it's also not necessary that a person with lung cancer is a smoker. The same way, the risk group that is more susceptible to low back pain is the first one being obese and tall persons. These people are more susceptible to get low back pain in their lifetime. Then women are actually more prone to get low back pain than men because of early osteoporosis. Then persons or people with bad posture, people with low muscle strength, low abdominal strength, low back muscle strength, and people with some psychological disorders or psychological factors also cause low back pain, such as depression, anxiety, hysteria, hypochondriasis. All these factors cause low back pain. Now, what causes low back pain? What diseases cause low back pain? Now, as I told you earlier, low back pain is a symptom of some other underlying disease. The diseases that cause low back pain are broadly classified into categories in which I will not go into detail, but I'll certainly touch them. Okay. Now, the first category of diseases that cause low back pain is degenerative disease category. Now, first you will have to understand what is degeneration. Degeneration is characterized by deterioration of normal structure that leads to loss of function. For example, there is a bone. What's the function of a bone? To give stability to the joint. Now, when the structure of this bone is deteriorated, obviously the function of that particular joint decreases. That causes low back pain. The diseases that come into this category are osteoarthritis. It may be of the facet joint, it may be of the intervertebral disc degeneration, it may be any other arthritic changes that happen in the vertebrae. The second category is inflammatory category. In this category, there are spondyloarthropathies, that is the ankylosing spondylitis, rheumatoid arthritis. All these are inflammatory disorders that cause inflammation in the spine. Now, without going much into the details of that, we'll move to next category, that is infectious category, that is any infection to the spine. For example, it may be a pyogenic vertebral spondylitis, it may be an epidural abscess, any infection in the spinal column or in the vertebrae that leads to low back pain. Now, the next category is the metabolic category. Now, before going to metabolic category per se, you should understand what is metabolism actually. The chemical process that occurs to maintain a healthy body, that is called metabolism. Any disruption or any hindrance, any disturbance in this metabolism will lead to a metabolic disorder. In the case of a bone, it's called as osteoporosis. That is the formation of bone, that is basically the formation of calcium is disrupted, due to which there is weakening of bone, that is called osteoporosis. Now, this osteoporosis also leads to low back pain. So the next category is neoplastic category. Neoplastic in the sense anything that is abnormal, anything that any growth that is abnormal. Basically, in general, it's called a tumor. The tumor can be benign or malignant. Okay, these tumors also cause low back pain, and this tumor comes into the category of neoplastic disorder. Then there is traumatic category, that is understandable. Any fracture, any dislocation to the spine also causes low back pain. That is because these fractures and dislocation are caused due to trauma. So that comes under traumatic traumatic category. Then there is congenital or developmental category. Congenital in the sense present during birth, present from birth, or developed during the developmental years of life. Okay, developed during young age. Now, for example of this is scoliosis. Scoliosis is basically it's the abnormal curvature, abnormal S-shaped curvature of the spine. When you view a person from back, if the spine is S-shaped, then that is called as scoliosis. This may be congenital or developmental. Okay, and then there is musculoskeletal category. In this musculoskeletal category, the low back pain is caused due to abnormal muscular tension or bad posture or some other postural syndromes. This causes low back pain, which comes under musculoskeletal category. Then there is viscerogenic category. Viscerogenic category includes anything that it refers to the viscera, that is basically it relates to upper genitourinary disorders like renal calculi or any other infections in the genitourinary tract that cause low back pain. Sometimes it's also called as referred pain. Okay, because the problem is actually not in the low back, it's actually somewhere else which is being referred to in the low back. Then there is the last category is vascular category. Vascular in the sense arteries and veins, that's called as vascular category. The example for this vascular category disease is abdominal aortic aneurysm. Basically it's a fancy term that is used for cut down of blood supply to the abdominal area due to blockage in the main artery that supplies the abdomen. Now, we understood what is low back pain, who are all at the risk of getting it, and in general the classification of low back pain according to the diseases. Now it's very important for a professional to know the exact anatomy and kinesiology of the spine in general and of the vertebra in particular. Now I'll not go into details of anatomy and kinesiology since I'm making this video for general viewing. But I'll surely try to give you an idea of how our spine functions, or how what are the structures that are present in our spine. Okay, now I hope you can see this. Okay, basically I'll start by telling you that when you keep your hand on your hip or on your low back, basically you are keeping your hand on the lumbar area. Now this lumbar area consists of 5 lumbar vertebrae. Okay, this is the view, this is the front view, and this is the back view. So when you keep your hands here over the hips, you are actually keeping your hand on your lumbar area covering your 5 lumbar vertebrae. Now these lumbar vertebrae have got a body. The front part is called as the body and the back part is called as the vertebral arch. Now in between the vertebral bodies there is a structure, there is a cushion type of structure, a donut type of structure called as the intervertebral disc. Now behind the body of the vertebra there is a canal right from above to below. That canal is called the spinal canal, through which this spinal cord passes. And this spinal cord, the yellow structure what you are seeing here, these are the spinal nerves, which are the branches of the main spinal cord that comes from the medulla oblongata of the brain. Okay, so let that be the part of the anatomy part. That's enough for this video. But you will have to understand the anatomy of the disc, the structure in between the two vertebrae. You will have to understand a bit of anatomy of that disc. Imagine a donut. Okay, that donut is actually the disc in between your lumbar, in between your vertebrae, and the hole in the donut that is filled with jam. Okay, so the jam is called as the nucleus pulposus, and the whole of the outer donut is called as the annulus fibrosus. when pressure is exerted on the jam, there is no way that the jam leaks out. Okay, but if the pressure is so much, then the jam has to leak out somewhere. So what it does, it creates a hole in the annulus fibrosus, that is in the donut, and it tries to come out. When it tries to come out, if it comes out, then what is the structure behind the vertebral body? There is the spinal cord. It touches the spinal cord, and all your neurological deficits, all your tingling sensation, numbness, everything start when this nucleus pulposus comes out of the annulus fibrosus, that is the jam comes out of the outer part of the donut and touches the spinal cord. Okay, so that is called intervertebral disc lesion or intervertebral disc prolapse. Okay, now keeping that to side, we'll come to the evaluation part of the patient. What you should expect from your doctor actually. What you should expect from your doctor to ask you when you visit him for consultation for your low back pain. It actually gives the doctor more insight about its cause of pain, because as I told you, low back pain is just a symptom. The doctor has to diagnose the disease before treating your low back pain. Okay, so the first thing the doctor should ask, or you can expect the doctor to ask, is the mode of onset of the pain, whether it is insidious, whether it is abrupt. And then the second thing is about the pain, what are the aggravating factor of the pain, what is the relieving factor of the pain, what causes more pain, whether the pain is more during sitting, standing, how does the pain relieve by so all these things he has to ask. Then he has to ask about the duration, whether it is to get an idea about whether it is an acute condition or a chronic condition, from how many days it is, what time what time of the day the pain increases. So all these pain inquiries the doctor has to make. Then he has to evaluate the effect of posture, the effect of sleep, effect of exertion on your pain. If you sleep, how is the pain? If you exert pressure, how is the pain? If you stand, how is the pain? So the doctor should ask you or examine you for this. Then he should examine for effect of cough, sneeze or strain. If you cough or if you sneeze, the intra-abdominal pressure increases. So what's happening to your lower limbs? What's happening to the spinal nerves? Whether they are getting compressed during sneezing, whether they are getting compressed during coughing. So all these things the doctor should evaluate. Now after this, the doctor will examine for deformities. He'll examine for spasms, birthmarks, abnormal patterns, abnormal postures, etc. Followed by palpation of the aching area and also examination of your lumbar range of motion. How much you are able to bend forwards, how much you are able to bend backwards, and how much you are able to bend laterally, that is sideways. Then the most important part of low back pain examination is neurological examination. Okay, the doctor should test you for coordination, for muscle stretch reflexes, and also he has to gain a complete insight into sensory structure. Sensory examination should be done. Now after this, a couple of basic manual tests should be done, that is straight leg raising test. It is done in order to measure the extent of severity of the pathology that is causing LBP, along with one other test that is called the Faber's test. That is also equally simple test. Now some patients ask me whether x-rays are necessary, whether MRI is necessary. Now what's the importance of radiological imaging and diagnostic tests in case of low back pain? The first thing is X-ray. What is X-ray? It helps actually in detecting any dislocations, any degenerative joint diseases, or any narrowing of the disc spaces. Okay. Here, in an X-ray, you view only the bones, not this structure. The intervertebral disc per se, it's not visible in X-ray. What we see, these are the bones, and in this bones we can see any kind of any degenerative changes, whether osteophyte formations or any fractures, dislocations, we can see on the X-ray. Now CT and MRI are useful in detecting disc diseases and tumors, and MRI is actually more superior to CT scan. In this MRI, we actually can see the spinal nerves, we can see the intervertebral disc, we can see the extent to which the disc is damaged, we can see how much the disc is damaged, and accordingly we can classify it according, that is, if there is a slight disc bulge is there, or if there is a slight disc protrusion, or there is an extrusion, or there is a herniation of the disc, we can categorize this intervertebral disc lesions in an if we see in an MRI. So that's the importance of MRI, CT scan and X-ray. Now electromyographies also can be done to detect neurogenic changes and denervation, as well as to evaluate the extent of these changes. Now in an MRI, the disc can be seen distinctively, and the disc disease can be diagnosed using some of our classification, that is, we call it as McNabb's classification, where we classify it, we distinguish it from based on its severity. Now once the diagnosis is done, the treatment is actually very tricky. It requires all the skill and knowledge of the doctor or the person who is treating you. Now most patients respond to non-surgical conservative management along with exercises and non-steroid, that is NSAIDs, your painkillers, analgesics. They respond well, most of the patients, and doing a surgery for the sole complaint of low back pain is often unjustified. There is actually no need of surgery if a patient complains of low back pain. So a patient or a person should know when the surgery is imminent, when the surgery should be done, when it is indicated. The first one is, surgery can be done if the conservative management has failed over and over again, okay, and when the neurological symptoms are persistent and progressive, when there is life-threatening when there are life-threatening tumors inside, then surgery can be done. And then when the patient has and it should be seen that the patient should not have any risk of life. So all these things, if these categories are fulfilled, if these things are fulfilled, then only the surgery should be done. Now after all this, I should tell you, we can give you the best conservative, who can give you the best conservative management? Now none other than a qualified physical therapy specialist can give you the best conservative management for low back pain. So the next time you get low back pain, first visit a qualified physical therapy specialist specialized in orthopedics, and then you can, if it doesn't work out, then opt for a surgery. Okay, so this will be all about low back pain for now. We'll meet up with next topic some other time. Till then, take care, have a healthy life, bye bye.